Hi everyone, my name is Brittany and I'm doing a 5-part series on my open heart surgery experience. Now if you haven't watched parts 1 and 2, I suggest you go back and watch them to get yourself caught up. In this video, I'm going to be explaining what my at-home recovery process was like. Let's jump back in. For the 3 months I recovered at home, I recovered at my parents' house because they took care of me. My brother actually drove me from the hospital to my parents' house, which was a 2-hour long ride, and I asked the nurses for extra medication to get through it, and I'm sure glad I did, because as I've said before, as long as your torso isn't moving, your pain management is fine. But once it does start moving, that's when you have to manage your pain level. And to give you some ideas of things I could do and things I couldn't do, so I would walk around with my elbows bent, because if my arms were hanging down, that put a lot of stress on my sternum and didn't feel good. But if they were bent at the elbow, then they weren't as heavy, I'll say, on my sternum. I also wouldn't turn on light switches because of the exertion that it required, but I was able to take a shower. And the nurses will teach you how to take a shower, but the summary version is you can sit in a chair and face the shower head, and you basically lean into the water one side while washing half of your head and then washing the other half of your head. And then of course you want to make sure that water runs over your scars to keep them clean. I didn't have any scarring issues with my long scar, but I did have issues with my stomach scars because the tubes were so long. I basically had holes in my stomach. So that was something that I had to attend to during the after surgery doctor's appointments. Another thing I want you to be aware of is that your back and your neck are really going to be sore for the first few weeks after surgery. Remember how I spoke about all of the muscle that will be pulling and tightening and recovering? This results in your back and your neck really being sore, so expect that. Also, you can't drive for 6 weeks because there's basically nothing protecting your heart and other vital organs. So if you were to get in a crash, your steering wheel would go through your chest. You can of course ride in the car, but you can't drive. And to do this, when you're riding in a car, and actually you're supposed to be doing this all the time, but they give you a pillow and you're supposed to hug this heart pillow, and it actually feels a lot better. I didn't use it all the time, but I used it when I sneezed or when I coughed, and that helped my pain management level by far. Also, I really suggest you go to cardio physical therapy. I thought that I would go the first time and then glean whatever they told me and then apply it to my life and do it by myself after that. Boy, was I wrong. I really suggest going because they not only help you get on your feet more, but they treat you holistically. So everything from what you're eating, how you're sleeping, your mental health, and then of course how you're physically treating your body and how to best integrate you back to your normal everyday life. So I highly suggest doing that. I did it for as long as insurance would cover it. I'm not sure how long that was, but do cardio physical therapy. I can't stress that enough. Let's talk about managing expectations. When I went into surgery, my expectations were a chasm away from what I actually experienced. And I want to share these with you so that you don't go through the same frustrations in terms of not having your expectations be reality like I did. The first thing for me is sleep. So when I was in the ICU and in the hospital, there's just so much commotion that I didn't really get any sleep. I was so excited to go home so I could just get a wonderful night's rest. When I got home, I realized that I couldn't lay down. Remember how I said that everything is so tight and you're hunched over? Yeah, it hurts to lay down. Therefore, I spent 3 months basically in a lazy boy recliner. Ate, slept, watched TV in it, did everything I could. I could say that a year and a half out, my sleep schedule was back to normal. I could confirm that after 18 months, I could get a full night's sleep again. Sleep was just one thing I really struggled with. And I share that with you because your battles in recovery may not be short. They may be a long battle, but I battled that one for a year and a half, and you can certainly overcome whatever you're going through because I did. It was hard and it was long and it was frustrating, but I guarantee you, you can get through it like I did. Number 2, I was really scared of getting addicted to oxycodone. So a few days after surgery, I think they try and wean you off of that and get onto other pain medication. But because I had sleeping issues, I stayed on it for 4 weeks. Granted, towards the end of those 4 weeks, I was on such a low dose that I thankfully don't have any addiction issues today, but my expectation for myself was that you will get off of that stuff as soon as you're able, no exceptions. Don't set those kinds of expectations for you, because even though you might not make them and your journey goes on a different path, don't let those frustrations bleed into everything else. That's what I had to do for my recovery. And even though before surgery, I was so scared of it, I trusted myself and trusted the doctors as to what needed to happen at that time. And thankfully, I can say that that did help me during that month, and I don't have addiction issues today. And finally, number 3, managing expectations. You will be exhausted. So your body just went through a very traumatic event. Even thinking is going to be difficult. And I know that's hard to process, but once you're in it, you will understand. So I was exhausted from taking a shower was really bad, but it resulted in me watching reality television, because you then don't even have to follow a plot line within a movie. There's just no substance to it, so it gives you a reason to take your mind off of what's happening in your body. And this is where I'm going to plug in cardio physical therapy, because I was really frustrated at myself for having to watch TV all day, because I don't watch TV at all in my normal day. But my physical therapist said, no, Brittany, that's normal. You don't have it's exhausting to think, and therefore a lot of people turn to reality television because there's no substance to it to get their mind off. That's great, and keep doing that. And so making sure that you know that you will be exhausted going forward and how to handle it, you will be more successful than I was during your recovery. Okay, let's get back to me recovering at home. So after about 8 weeks, at that point, I was able to just lay down in a bed, and I was at the cusp of starting to get about an hour of sleep a night, which meant that I could drive back to my house, which was 2 hours away from my parents, and see friends every other weekend. That was amazing because it helped keep my sanity from sitting in my recliner and watching TV every single day, all day. And I did that for a few weekends, and at the 3-month point, I got permission from my doctor to go back to work. So that's what I did. Okay, everyone, that's the end of part 3. I hope you enjoyed it. If you have any questions, please comment with them down below so I'm able to include them in a Q&A session that I'm going to do at the end of this. You won't want to miss part 4, so let's go.